Guys, welcome back to my channel, Nurse Lexi. So thanks for clicking on this video. I am super excited to film this video for you guys because I wish that I had a video like this to watch when I was starting Med-Surg classes. I know for me, like, I took health assessment, skills, and foundations. Some people call it fundamentals, same thing. I took those classes my first semester and I was like, piece of cake, this is a breeze, whatever. And then second semester, I'm starting like into my basic Med-Surg course, and it was just completely different. Like, the test questions were different. The way I had to approach the material was different. How much I had to learn about the disease processes, and basically everything that was expected of me was different. And I honestly felt bamboozled because foundations, I could memorize information and then be fine for the test. But with Med-Surg, you really have to not just memorize it, but you have to learn it, you have to understand it, and you have to know how to apply it, and you have to know what the question is asking for. A lot of it is, what should the nurse do first? What's the nurse's priority? A lot of the times they don't even name the disease in the question, they just give a description of it. So you have to know what the disease is and like the pathology behind the disease. There was more select all that applies. So basically that's what I'm gonna get into for this video. I don't want to get like I'm off track. This video is going to be about how to study for Med-Surg and how to tackle some of the questions that you will get on your exam for Med-Surg. So just go ahead and keep watching. So when you are studying, I have here everything that you need to know about the disease process. You need to know, and also keep in mind, this is from my experience, I always write down and emphasize the things that my professors emphasize. And if we have a certain disease process and they don't go over like every single thing about it, obviously I'm not going to learn every single thing about it, but these are the things that I see most often from test questions and things that are expected for us to know about certain disease processes. And that is going to be the risk factors for getting that disease, the signs and symptoms. So how is your patient going to present? That's also the clinical manifestations, same thing. You also want to know the cause of the disease, which is the etiology, and you want to also know the pathology. With that, it depends like how in-depth you need to go. Sometimes I look up the pathology just so that like I can get it in my head to understand what the disease is doing in the body, and then how that's going to affect other like body systems, or how it's going to affect their labs and things like that. But I think it is good to know the pathology behind the disease process as well. You also want to know how to diagnose this disease. So for example, you have someone, let's say like COPD, you know, like what type of diagnostic test is the provider going to want to run on this patient? So like, what can you expect? What kind of orders can you expect to get from the provider? Is it going to be like a CT, X-ray, like just things like that, certain labs. So like, what diagnostic tests, labs, procedures do you expect to be done on your patient if they suspect that they have this disease? You also want to know the treatment. So your patient has this disease, how are they going to treat it? What are the pharmacological measures, and also what are the non-pharmacological measures? Both are just as important. You also want to know the complications behind the disease. Is this going to put them at risk for another disease? And how is it going to affect like their day-to-day, things like that. And that goes right into teaching. So you want to know how you're going to educate your patient. They have this new diagnosis, and what do you need to educate them on? Is it diet? Is it lifestyle? Is it what to look out for certain side effects to their medications? Is it, you know, that they're on a blood thinner, so they have to get blood drawn, you know, every so often so that the dosing is correct? You just want to know what's important for you to teach your patient. So just to show you guys how I do this, I'll let you guys see some of my notes. And this is just a really good example because I hit on like almost everything that I talked to you guys about. So this is for lung cancer. I have here the, I have here the etiology. I have the epidemiology, so like who's it going to affect. I have the pathology, basically. I have the clinical manifestations. How's my patient going to present? I have how do you diagnose it? Like what are some of the things that the provider will, put orders in for? I have some interventions. Nursing care, this is, things that are more nursing focused that you have to know as the nurse. And then I have, what does that say? Oh, palliative care interventions. And then I also have drug therapies for lung cancer. So that's basically how I would like outline it. Again, I don't really do that for every single disease because if my professor doesn't go into detail about it, then we're not really expected to know it. This is another example. This is just calcium for electrolyte imbalance. So I have up top just some information about it, about what calcium does in the body and how it's regulated. And then I have hypo and hyper. I have both of their signs and symptoms, causes. I have the treatments for both of them. I have the RN responsibilities for both of them. Yeah, so this is how I would outline it. I feel like everything that I told you guys is basically what you need to know about the med. Like it is so important that you understand how to diagnose it, how to treat it, how your patient is going to come in. And then when you take all that into consideration, you can come up with your priority for them. When you can see the whole picture of your patient, you can say, hey, my priority for them is airway, or my priority for them is hydrating them, because maybe we're talking about HHS for diabetics. Like your number one is fluids. Like when you can have a good understanding of the disease process, you'll know where your priority lands as the nurse. This is just another example, like heparin-induced thrombocytopenia. Like you guys can see, I put the pathology, the diagnosis, the manifestations, and then the management. So I didn't put like everything. I didn't put risk factors. Well, I did. I put incidence is increased with these things, so that kind of is like risk factors. But sometimes you're not going to put every single thing, just like what your professors expect you to know, basically what they teach you. And also, if you're studying two diseases that are very similar, just compare them. Like I took pages of notes on DKA and HHS, which are both complications of hyperglycemia, but then after all of my pages of notes, I just like kind of very simply compared them so that I could look back on this and just know, okay, this is type 1, this is type 2. Bam, this is rapid, this is more longer onset. This one, your glucose is about 350 or greater. This one, in glucose is way higher. It's like 600 or greater. So just make sure that you're comparing them so that if you get a test question and they are very similar, you'll know how to differentiate them. This is another example for you guys where I didn't flat out compare them, but I made sure that when I was studying, I understood the difference. So for coagulation disorders, I have autoimmune thrombocytopenia, which is ATP. That's just a shortened version. And then thrombotic thrombocytopenia purpura. So basically their names sound the same, and both of them are going to manifest with a low platelet count. So you kind of want to know, how are you going to tell the difference? Your patient comes in, they have low platelets. How do you know if it's ATP or if it's TTP? So when I'm studying, I make sure that I understand what's the difference. And they're also both autoimmune. So, and there was a question on this too. I knew there were two similar, so I really had to know the difference. So basically with the first one, your antibodies are attacking your own platelets. With the second one, your antibodies aren't attacking the platelets. What's going on is that your platelets are getting stuck in your capillaries. So with both of them, when you do a blood draw, your platelets are going to be low, but for two different reasons. So if you understand the pathology, if you understand what is really going on with the disease process, you'll know how to differentiate them and you'll know how to get that question right. And also, you guys know with Med-Surg, you have to know your meds. If you have not watched my pharmacology video, definitely check it out. You need to know your meds, why your patient is taking them, the side effects, the nursing implications. Like, you have to know your meds to be a good nurse, basically. So I'm really confident that if you guys study that way and if you learn all those different parts, you know, about the disease, you will ace Med-Surg. Like if you really understand and make sure that you know all those different like the treatment, the diagnosis, the signs and symptoms, like if you can really confidently learn all that, I think that you will ace Med-Surg. That's what has just been my saving grace. And if you study in a group, just quiz each other, like throw out a disease and be like, hey, how would you diagnose that? Or hey, what are the signs and symptoms? Or what are important things for you to teach your patient about their disease? What meds do you give for that? Like definitely make sure that you know all those things that I listed earlier. And now I just have some practice questions because I feel like sometimes I hate Med-Surg questions. I just hate them, and they're like NCLEX style, whatever. We have to know them, we have to do well on them, but sometimes they're annoying. So I just wanted to go over some of them with you guys. So this first one I'm just gonna put like over here. It is saying a nurse is assessing a client who has been taking prednisone following an exacerbation of inflammatory bowel disease. The nurse should recognize which of the following findings as a priority. You guys can read the options and then kind of see, well, I circled the answer, sorry. But basically for this, what I want to point out is that you need to know what's important in the question. The important thing in the question is that they're taking prednisone. And it's important for you to know that prednisone is a corticosteroid, and one of the side effects of steroids is that it suppresses your immune system. So the priority for the nurse wouldn't be any of the other options besides C, because if your patient has an elevated body temperature, most likely what's going on is an infection. And if they have an infection and they're on a steroid, they don't have, you know, the same elevated immune response that they would have if they weren't on that steroid. So that infection could be way more harmful for them because of their suppressed immune system secondary to the use of steroids to treat, you know, their IBD. So you kind of just have to break down the question, see what's important, you know, and just ignore everything that's not. Honestly, the fact that they're taking it for IBD is not really important. What's important is that they're taking prednisone. And what are the side effects of prednisone? And what does an elevated body temperature mean? Usually means infection. This next one is like kind of easy. It's talking about a patient taking iron, ferrous sulfate. So basically from that you can tell that your patient is probably anemic. If they're taking iron, they most likely have iron deficiency anemia. And what is important to know when you're taking iron. So this is one of the things where it's kind of telling you, well, it's straight out asking you what's some patient education to give to that patient. And it would be C, the medicine with foods that are high in vitamin C to promote absorption. And that's just something that you would have had to have learned and realized was important. You can rule out A because the stools will be dark black, they won't be red. You can rule out B because milk actually milk decreases the absorption effect of iron, so you don't want to take your iron with milk. And then D is wrong because you don't want to take it for 14 days. It actually takes 4 to 6 weeks for you to even see much results. So also, if you can like rule out everything else and then choose whatever's left, then do that. But you have to know your information if you're gonna try to do that. And some little just extra hints for you guys when you have questions that are not so like science material based, but are more so like nursing process or like therapeutic communication, things like that. If one of the options says, if the question is like, a patient is concerned, what should the nurse ask them? You never want to choose an answer option that says why. Never choose it. That is not therapeutic. You don't want to ask your patient, why do you feel that way? Because that can come off kind of like standoffish, you know? So you never want to ask a patient why. Our professors drilled that in our heads. And if there's an answer choice that's going to allow the patient to talk, you know, and to open up and communicate, it's probably that answer. If it's something that will get them to talk and communicate, it's that, you know. If there's one that's comforting and one that, you know, you're asking the patient more in depth about how they feel and like addressing their concerns, and you know, it's the one where the patient is going to talk to you because they always want the nurse to have that open communication, that therapeutic communication with their patient. That is just easy points for you to get if you see a question like that on your test. Also, another tip, I always think about the ABCs when I have a question that asks me about priority. When it's something like, what's the nurse's priority, or what's the first thing the nurse should do, think of ABCs: airway, breathing, and circulation. Those are the foundations of the nurse's priority, you know? Like if it's something where you have an option that's like assess their airway or assess their urine output, 99% of the time it's going to be airway, because if they stop breathing, it doesn't matter about their urine output. Always think about your ABCs: airway, breathing, and circulation. But that's pretty much all the tips that I have for you guys. I hope this video was helpful. If you guys have questions, definitely just leave them down below. Don't forget to like, comment, and subscribe, and follow me on Instagram at LexForeverXXI. But yeah, please let me know if these tips were helpful. If you have more tips for Med-Surg, leave them down below. I'm still taking classes, I'm still in school, so I could use some new tips as well. But anyways, thank you guys so much for watching.